Carlos, thank you so much for joining us. I would love it if you would just give a quick intro of who you are, but then a longer intro of your story with Rubicon. I was able to follow it for a little bit, but it's gone through a beautiful arc. And yeah, just bring us up to speed on who you are and where you're at.
Yeah, awesome, guys. Thank you for having me. Excited to chat today. Excited to see you, Niko, and also we used to work with Redux, so that keeps going. Um, Let me just see if I can view everyone. So I'm not just looking at my face. There you go. Awesome. So yes, quick background on myself. I'll do both because they're very interconnected. So name is Carlos, originally from Spain, born and raised in Madrid. Been always passionate about healthcare. Got interested in it as a kid. I unfortunately had an accident on my left eye when I was 8. I was out in the street playing with other kids with slingshots, and I was hiding behind this car. This kid was too accurate, hit me in the eye. They took me to a local clinic. They said, you'll be fine, use these drugs and go home. And 5 days later, turns out I wasn't fine. I was getting emergency surgery, beginning of 3 years where I had to undergo multiple surgeries and ended up losing sight on my left eye. It's actually a pretty tough episode for an 80-year-old, but it's also what gave me the drive and the motivation to want to build a company with this mission to democratize access to medical expertise. I went on to become a biomedical engineer, started my career at Siemens Medical, working on their EMR, which then became Cerner, and now Oracle. Then I was in just tech for a few years. I was back in Spain. There wasn't a sexy health tech scene. I probably wasn't ready to start anything. And then in a kind of unexpected turn of events, I moved to Boston for business school, which had never been in my plans. And that's when I used the opportunity to get into entrepreneurship. Met Gil pretty early on, and started working on this idea. The idea for RubiconMD is actually pretty simple. It's getting a primary care clinician to connect to another specialist so that they can make a more informed decision on their patients. So imagine the patient doesn't participate in the interaction. It's about the patient, but the patient doesn't interact with this. It's the PCP sees the patient, they have a question, they don't know what dismal is, they don't know what these labs are elevated, they need help interpreting an EKG. So they turn to RubiconMD, they submit a consult, one of the top specialists in the field will review and get back to them, typically within 2 to 3 hours. And that input helps the PCP make a much more informed decision on diagnosis, treatment plan, and next steps. And it has multiple ramifications. For one, providers will report that about 80 or 90% of the times they're able to do better care. So they put in place a better care plan for their patient. I think that's above all the most important. But also 50 to 60% of the times they avoid a referral that would have been unnecessary to a specialist, and that generates savings for whoever pays for healthcare. Can get into it as much as you guys want, but it could be the payer, it could be the employer, it could be the capitated provider. So it's a business that does the best thing for the patient and also saves money for the system, which is wonderful from a value creation standpoint. It also has some limitations, which is we are a tool that works perfectly for value-based care, but value-based care continues to be a small market. It's growing. 10 years ago, folks were promising it's imminent, it's gonna happen overnight. It's grown in the last 10 years, but far from what was promised to be. It's very small. So we kind of built up a niche and worked with a lot of the innovators in primary care. Oak Street and Iora were typical clients on the MA side. A lot of the commercial employer on-site clinics, Crossover Health, Everside, all those groups. We work with a lot of Medicaid plans. That's like an interesting, different use case a little bit because it's not so much about the ROI as it is about providing access. Patients who are Medicaid, they don't get access to specialty care, barely get access to primary care. So to support providers at FQHCs with this tool was, game changing for them and their patients. That was a very, very interesting part of our business. We work with correctional healthcare providers. It's also like an interesting niche. Think about the ultimate example of on-site and fully capitated type of care. And then one thing that was always beautiful about the mission is this idea of democratizing access to medical expertise. We have this micro example that I love in California, where we were live at the so Facebook, in their headquarters in Palo Alto, they have a clinic. Like if you're a Facebook employee, you can go to the doctor inside the offices, and there are like 5 or 6 doctors, and they use us, and like it makes sense for them. Facebook as a self-insured employer, they don't want their employees to have to leave. They want to give them the best care, and it reduces cost for them. So it was great, and it's a really cool partnership. But if you think about the typical Facebook employee, they have all the access in the world. They can take time, they have the best insurance, they can go to Stanford around the corner, and then like 10 minutes from their offices or 20 minutes, there is this very big network of FQHCs and across the East Bay, where it's just Medicaid, uninsured, and those patients can't get access to any specialist. And it's beautiful to be able to connect both of them, right? Those at the top and at the bottom of the economic pyramid to the expertise of the best specialists across the country. And that's, funny enough, that's been one of the main reasons why these top specialists who don't need to do this on the side keep doing it, because they get a lot of satisfaction for being able to transform care for underserved communities. That's RubiconMD as a business on the market, and just to give you guys a bit more on the trajectory. We started the company in 2013. That year we did a small, kept the seed round open for like a year and a half, raised about 1.2 million, combination of angels, and then small funds, and Fina Health actually invested in our seed round. We thought it was going to be the market opener, connect to their EMR, and then get access to 80,000 doctors. Turns out very few, at least in 2013, 14, very few of them were in value-based care, so they ended up not providing the value, but they were a valuable investor regardless. And then we did a Series A a couple of years later, about 4 million, Series B in 2018, that's 10 or 12 million, if I'm not mistaken. That was led by Optum Ventures and HLM, and then we started to grow our presence across United a lot with all the Optum clinics. Eventually, we got Centene also to invest in the way. So we had a combination of VCs and strategics. Did a Series C in February of 2020. Talk about being lucky. We closed around 1 month before COVID hit with Deerfield, and by the time the pandemic came, we had raised just shy of 40 million across all those rounds, and then COVID hit. And guess what? Nobody was going to their PCP, and PCPs had 0 questions, 0 consults. We call them e-consults to submit. So we had our volume go down very aggressively, and then things started to open up, and folks were going back to their PCP, but they wanted to avoid sending them to another facility at all costs. So volume spiked more than ever. People started calling and saying, "You guys have a platform. You guys have specialists. Why don't you direct to patient?" Especially for Medicaid, because the teledocs and the Amwells were busy with all the commercial, and nobody was servicing them. And this is like state secretaries calling us and saying, "Can you do this?" So we played with it. We debated acquiring a telehealth company, and ultimately decided to go in the direction of just doubling down on this idea of virtual specialty care. Launched a behavioral health component to our solution. That was the implementation of the collaborative care model. So think about clinic has a behavioral care manager, and we bring a remote psychiatrist, a registry, and all of that. And with that idea, we said, let's just do this for every specialty. And And to do that, we wanted to raise another round. So we were gearing up in 21 for our Series D and I told you, like, look, we're gonna raise another 40 million. I gotta go to our top 10 clients and make sure that this is gonna make sense for them and that they will be willing to pay 10x what they pay today. Because with our contract, with our ACV, our annual contract value, we're gonna need many more groups and there aren't enough in value-based care. So we gotta make sure the economics work for them. And funny enough, that conversation led to Oak Street saying, actually, this is fully aligned to what we want to do. We can help you build it. We'll want some upside. So we'll be interested in investing. And it started as an investment discussion. It was part of us raising our Series D. And then one day they came with a term sheet. We told them we didn't want to sell the business. What they said is, we'll buy the business, but you will be run completely independent of Oak Street. You'll be an independent sub. You will continue to be RubiconMD. You guys will keep working with all your providers. And for the last 2 years, it's been exactly like that. We've grown a ton with them. They've been incredible. And I was ready because I've so many friends who have terrible acquisition stories and people destroying value and all of that. Oak Street has been incredible. As you may know, they got acquired themselves about 6 months ago by CVS Health. So in a most unexpected plot twist, I work for a Fortune 5 company now. We still have a lot of our independent TBD for how long. Things are different with bigger companies, but so far it's been great, and it actually has the opportunity to unlock a lot more growth across CVS, which when you bring it back to our mission around democratizing access, we're pretty proud of the scale that we got to, but it's tiny. It's like a drop in the bucket when you look at US healthcare. So this idea that through a big player, you can enable anyone to get access to something that's so valuable for patient care, it's pretty exciting. So that's where we are today, about 100 people. Niko, let me know if I think I should shut up and questions and make it a bit more interactive. Will be more fun.
Yeah.
But happy to chat about whatever you guys think is most helpful.
Yeah, this is awesome. Thanks for that overview. Obviously, a story that is a fairy tale in a lot of ways, but I'm sure that came with a lot of challenges throughout. I'm going to ask you about some of that, but just for the audience, I know many of you probably have questions that you'd love Carlos to answer. So if you do, drop them in the chat, and we'll get to them. But Carlos, I'm particularly interested. You got to a point where you ended up working within the safety net, within jails. It's fascinating, right? But like, talk us through your first. The idea of Rubicon is it's broad. There's network effects. It's complicated from a business model perspective. How did you get from 0 to 1, like your very first customer, and then how did that eventually lead you to working within the safety net?
Yeah, it's in a way it's like the easiest to explain idea, but the hardest to explain business model.
Yeah.
Right, because like who pays for healthcare is so far from who uses the tool, and that has been a massive barrier in many fronts. Just to address it head on, if you are a fee-for-service provider, which the majority of the providers are, like more than 80% are probably still fee-for-service, why would you use this? It's a waste of your time because they don't pay you to do better care. This actually happened. We walked into an FQHC and they said, "This is a beautiful idea. I love it as a clinician, but like, what's in it for us? We get paid. We have to see 30 patients a day. Why would we waste 10 minutes in doing better care? Because now I have to ask the question, get the follow-up, think about it, implement the next steps. Nobody's going to pay me more for that. I get paid for making it into somebody else's problem and moving on to the next patient." So the barrier with this misalignment of incentives was pretty high. And like, it worked in Medicaid because they literally can't get their patients to go see a specialist. They would love to send them, but they can't because half of the country doesn't take Medicaid. And because if someone's in Medicaid, it's because they probably can't also afford taking a day off. They may be an hourly worker, so that may be that day there's no income, there's no food, they can't afford transportation. There's like so many barriers. But that's a bit later. How we got to our first clients. The first places where, well, first thing we did is, this was just an idea. How did we find our first user? And Gil's brother had trained with a doctor in Connecticut who was actually running an urgent care. And it's funny because what we do doesn't make sense for urgent care, but this was rural enough that the community used it as pseudo primary care. And he was the first person to use the tool. So it was a personal relationship. We gave him some shares to test out the idea, and for 3 or 4 months, he was the only user. And then we got into Blueprint Health, the incubator that existed in New York 10 years ago. And through that, we met 2 clients, Iora and Q Lions. Q Lions doesn't exist anymore, but it was one of these fully capitated primary care models backed by Jeff Bezos and Michael Dell. And those were our first 2 groups. Thankfully, they had great leaders that said, let's give it a shot and we'll pay you fairly for that. And that was incredible because we were building the tool, but we got to build it together with them. And that's the first time that we got to some small scale. I'm talking about maybe 30 doctors using it for 5 or 6 months, where we got to track the outcomes and understand this actually has a very good business case. But then we had to figure out for whom, like who do we sell this into? And we had a very early hire who was very good, very scrappy at sales. And he came with this idea of the 1990. He wanted us to do 90 in-person meetings in 3 months. And it was wild. We would start sending emails to people like, take Nashville. Hey, we're gonna be in Nashville, 2 weeks from now. Love to meet with you. We didn't have any plans to go, but as soon as 2 or 3 people, said, yeah, I'll see you. Okay, we'll bought flights, and then we would go there and have, 7, 8 meetings a day, whether it was with, potential buyers, VCs, people in the local community. It was very intense, but we learned so much. I think that's when, coming out of that, we realized there's actually these segments around capitated primary care, generally for Medicare Advantage population, where this will be a good fit. Commercial, it's not, we learned that big employers tend to be self-insured, and the bigger ones build on-site clinics, so actually that's a nice fit. That's where we also discovered corrections, generally Department of Corrections subcontracts this to a private vendor on a PIPM, which is a per inmate per month, all in cost. And then they send the PCP to the facility, but every referral, you get to transport an inmate to a hospital. It's very expensive, very difficult logistically, the safety hazard, all of that, and Medicaid. And then we also found this market of direct primary care, independent providers, started going to conferences, but it was a very aggressive on the field, meet with a ton of people, very intense effort for 3 months to learn not only how these potential buyers operate, but also their business model and how they get paid.
Yeah, you've said a couple things here that I want to make sure we underline and call out. First off, talking just about how users are not the payers of it. And so getting clear on what are the incentives involved for everyone who has to say yes in the buying process, like understanding that at that level. But then just now talking about how you guys flew out and had these in-person meetings. This is something I see that successful companies frequently do, is that founders are often having in-person meetings, sales meetings, but they're really meetings about learning the market, learning where your business fits in the market. And a pitfall I see oftentimes is trying to scale sales too early or outsource sales away from founders, where, if you had that sales guy go out and do it on their own, the learnings that came back and eventually shifted your model and shifted the product, you wouldn't have had that. So I want to underscore that emphasis on Yeah, it's sales, but it's also really learning how your product fits in the market. And I think that your example illustrates that beautifully, in that you put yourself in a situation where you had to rapidly learn from every single person you were talking to.
Yeah, 100%. And I feel very strongly about this. There is no better salesperson for your org than yourselves. That's it. Not like the best salesperson in health tech is not going to do it as well as you do, because no one cares about your business the way you do. And like my story, think about when we started the business. My co-founder Gil, who just left the room, he's American. He's been in health tech. Like when we started the business, I was just doing all the internal work. I was doing all the operations, the tech. I'm an engineer. Like, heck, I just got into the US. I knew nothing about US healthcare. I knew nobody. I spoke broken English. So like, what would I do in sales? Like, it just didn't make any sense. So for the first probably like year and a half, I was just doing like the operations, build the MVP, work with engineers, and all of that. But then I started taking on the commercial work, and like on paper, I was the least prepared person to do all of that. Like, funny that when I started pitching the idea, first question I got was like, "Are these specialists in the U.S. or what country are they?" I'm like, "No, they're here. They're legit. It's just me who has the funny accent." But like, one thing I realized is that because I care so deeply about understanding how this could work, I got really into the nitty gritty of understanding how their business worked. And I wasn't there to BS anyone on, shoving this down their throat. I really had to be convinced that this would work for them, because otherwise I would close one deal who would then die 6 months later or churn in a year and be like useless for the business. And that was actually the key for the first 2 years. I was doing the majority of the sales, and we can talk about how do you transition from you doing all the sales to building a sales team, which is so hard to do. But to me, the big revelation was, if you are very honest, very transparent, really care about learning about their business, you listen, you become the best salesperson, because you're not selling them anymore. You're like building it with them. And by the way, now it's a bit more, it's a bit busier and a bit more noisy, because everybody's reaching out with innovations and all of that. But the minute you get someone's attention and they work at a provider or payer, their day-to-day is kind of boring, right? It's like a lot of the operations, the same issues with the clinic, staffing, all of that. So what I learned through the years is, for many of these traditional players, they call with us where they're like, "Oh, it's our innovation hour." Like, they would come excited, we would talk about ideas, and that made it a lot of fun for them, which meant they had more energy and more interest in trying out new things. So obviously this didn't happen with everyone, but that switching from "I'm here to give you a nice pitch, a flashy pitch, and like, convince you," to I'm more of a consultant working with you to understand if this makes sense, and you're helping me build it. And if it's mission driven, even better, because they're not in defense mode anymore.
Mm-hmm.
That was pretty shocking to me. And actually, Gil and I ended up doing, like, year 3 into the business, a full 180. Like, I took over all of the commercial side of the business, marketing, sales, implementation, account management, and he took over all of tech, operations, product, data, and all of that. And that was very unexpected for me.
Wow, that's fascinating. Yeah, and I think you said a couple things that are important here, in that, and we heard this in our intros. We went around and everyone did intros and talked about their businesses. And this is the thing I love about healthcare technology, is that everyone is so passionate about doing right by patients and making an impact on our system. But oftentimes it's not obvious how that impact is going to be implemented from the perspective of who's going to pay for it, how it's going to like technically work. And so from a cultural perspective, I feel like we need to be humble enough going into those meetings with different types of care providers who serve different types of populations to not say we have figured it out and here's how it should be work, but really go and say, we might have some evidence that this works. We might have some experience, but we're here to collaborate with you and figure out how it might work within your organization. And it might not, and that's fine too. But having that collaborative mindset, I think, was certainly success, like what drove the success for Redox, and it sounds similar in your aspects as well. Shifting gears a little bit, I would love to see if Ryan, would you like to ask Carlos your question? I think it's a great time for that, or I can ask it too.
Yeah, sure. Thanks again for sharing experience, Carlos. Question on how did you really engage with larger entities, and also from like larger health systems or as a whole, and navigating those, as well as the second question is how did you really engage with some of those corporate venture capital firms? Because again, like Optum, United Health Group is massive. So how do you not only engage with these large corporate VCs, but also just from like a purely like sales perspective? I mean, we've read a lot of and watched a lot of Redox sales resources. We still actually still link those to for our sales folks. But Carlos, from your perspective, kind of like what did you do starting out? What do you guys do now? We'd always love to hear what others are doing.
Great, thanks, Ryan. That's a great question. And I have one story of an early client that I forgot to share, but it's very, very pertinent to your question, which is health systems. Turns out that health systems are not a great fit for what we do for a bunch of reasons. One, they have all the specialists in house. They don't feel they need help. Two, they're not really interested in reducing unnecessary costs. And three, they've already invested enough in Epic for the most part. So if you can figure out a way to do it on Epic, that's it. But our first big client was a health system. And I still don't know if it was the best thing that happened to us at that stage or the worst. And the story is like, we started the business and then we read a paper from someone at UCSF at San Francisco General, or the Zuckerberg San Francisco General Hospital, and they published this beautiful paper around e-consults. And we're like, shoot, this is exactly what we're doing. They have evidence they've done it at a hospital. We should go talk to them. And we go meet them just to learn and to build a relationship with, the only other person in the world who was talking about this thing, because this didn't exist as a category, which it's a separate topic, but for 5 or 6 years, it was us educating the buyers without any competitors, and that's probably like worse than having to be a competitor. But we go meet them, and they're like, yeah, we've been using it here for years. The massive numbers, it's all internal. By the way, the engineer who built it 15 years ago is about to retire, so we need a new system, and we put out for bids, and we have a bid from Microsoft and a bid from Salesforce. Do you guys think you can do it? By then we're like 4 people in the business, don't really have a platform. Like, no, in no world we could do that. But like, well, let's give it a shot. So we put together like a demo with their workflow and our slides and all of that, and they're fascinated with our solution. Why? Because it's the only one that's listening to their needs and building it according to their expertise. And it makes sense. Why would Microsoft or Salesforce bother to put a lot of effort into this niche thing? So they end up going with us, and we build a system for them, but we weren't ready. From a contracting standpoint, this is a contract with the city of San Francisco. It took 1.5 years, tons of money and lawyers, requirements that we had to meet. They also had us install this on their premises. So like,
on-prem.
Who's doing that? Like, these
on-premise. I remember Niko's story about the on-prem.
It was a crazy amount of work, but like, they were a very big deal. They were the ones who knew about it, the best brand. They helped us with fundraising, with marketing. Did we learn a lot? Good for so many things. But our engineers hated it. And also, we didn't have the most sophisticated tech team at the beginning, so it's not like they were just building like their features on top of our code and all of that. Like, creating this spaghetti thing that took us years to unwind. Providers, engineers were like leaving because they hated to be part of a hospital dev shop. So some of the folks who are still with us have some PTSD from that, and we just went to customers who were a better fit for our size, and that's like we probably built our first $2 million in revenue with accounts that were no more than 100 or 200K. Think about provider
How
groups
did you?
anywhere. Yeah. Sorry,
How did you balance like because a lot of times some of these larger systems will like working with smaller companies because they're like, well, they'll build exactly what we want versus actually like, yeah, you built it specific for this health system, but you can't actually start selling to other health systems because it's specifically for like this one entity. Like, how did you balance like the different
No,
types of features and things like that?
I don't know if you can. If you find someone who's able to figure that out, I would love to learn how they did it. But the CIO at a hospital is in the business of paying Epic $100 million to get their own instance customized to do exactly what they want. They're not, building for scale and for many providers. So we just steered away from that. We went to provider groups, and at some point they grew a lot, so our accounts got bigger. So, sometimes 500, 1,000 providers, but for many years they were smaller accounts, and that helped a lot grow with them. To your question on payers, when we signed our first payer, Optum Ventures invested in us because HLM had given us a term sheet, and they kind of brought them to the table.
Okay, they were co-investors. Okay.
They were very early. I think we were OV's third or fourth investment, so we didn't even know they existed. I actually was kind of blind to the whole Optum world, which ended up being a massive growth opportunity for us. Very different story now. They've invested in 60 or 70 companies. They have a big team. They are at every conference. So I would 100% advise to connect with those. CVS Health Ventures, Optum Ventures. Centene doesn't do as many direct, but they invest in HLM, probably a few other funds. I think it's interesting, but I think you should always have a balance. At some point for us, it started to get tricky because we started after Optum Ventures invested. It still took a year to do the MSA with United, so I don't think there's a way to short circuit that. And it was very expensive. We had to do increase our insurance, limits.
Cyber liability, yeah.
Everything. It's like all those things that had never even crossed my mind. General liability, cyber, everything. And once you get in, you have this hunting license, and we grew a lot through their internal groups. And at some point, it was they went from 0 to 25% of our revenue in a year and a half. And now it gets tricky because if they're your investor and your main client, you can put yourself in a position that they give you a low ball acquisition offer, and it's either you take it or we walk away with the revenue, and then your company's worth less. So you want to keep a healthy balance. So we took Optum and Centene, and they both made sure they had the same rights and offers and all of that. And I think that's the key. They can add value, but keep a balance and be careful with diversifying your revenues.
Gotcha. And really, just your introduction to the corporate VC side was primarily just an introduction from another investor that
in that case. But look, for Centene, it's because they were a client first.
Okay.
They got interested, and actually that's what drove HLM has them as an LP to want to lead that round, and then they brought Optum Ventures. So I think it's a very powerful sign if you sign them as a client. In fact, that's what you want to do because you would much rather have the revenue than the investment. Because revenue is the least diluted funding you can get. But that definitely helped a lot.
Well, I mean, having other investors would wonder, well, they're investing in you, but they're not one of your customers. So that would kind of well, what are they doing, right? So that makes a lot of sense then. So, it's definitely helpful. We've also kind of realized the large health systems aren't necessarily our initial target market too, just given some of the purely regulatory stuff. So we're starting with more of the smaller ambulatory surgery centers and and especially if they're privately owned by physician groups. So, have you noticed? Because over the course of maybe 5 to 7 years, there's been increasing acquisitions of physician groups by health systems that is becoming a little bit more challenging to sell in this market. Kind of how have you approached, you and your team approached that over the past couple of years?
Probably not the most representative for us, because a couple of years ago is when we got acquired, and they let us run our business independently, but they really invested in driving growth inside Oak Street, and it's grown like gangbusters. Like we've probably done like 20x growth with them in 2 years, and it's all credit to them. They've been incredible as a partner. And then the external has been a bit more clouded with the COVID, post-COVID turbulence, and some of the cool down last year, and all of that. I do want to touch on one thing that I mentioned before, and it's related to sales. When we had to make the transition from, hey, I'm actually not bad at selling, but I've reached my limit. Like no matter how good you are, there is a limit to what you can do. Whether it's that's I don't know, maybe you can do 2 million a year, but you're not going to do 10 by yourself. You need more people. And in health tech, in B2B, that's a very difficult to make transition. And I learned it the hard way. I joined this peer coaching pod of, I was in like a founder pod, and I actually asked to get moved to a chief revenue officer pod to learn from those guys. And it was wonderful. And what I learned is that it's a process that's going to take at least 2 years, because one, you don't know how to do it. So you're going to make mistakes hiring people and sales leaders. Two, the signal to learn that you've messed up doesn't come right away. Folks typically need 3 to 6 months of ramp up. If your sales cycle is, for us, it was like weeks for a tiny practice to a year for a payer. Let's say average 6 months. Well, you got to give the person at least 6 months to see if anything is moving or progressing or closing. So it probably takes a full year for you to know if they're going to function. Many of them won't. And you also need to, because not all of them will hit their quota. If you want to make your numbers, you need to over dimension. So all those things, by the time I realized, it was too late. So we kept making misses and misses there. Also, not a place to experiment. You want to hire someone who's never been in healthcare as an engineer, in data science, in operations, fine. But for sales, if you're going to be selling into enterprises, very risky, in my opinion. So get the folks who will ramp up quickly. Also, much better experience, much better results with folks that we've grown within the business than the super flashy hire, the exec who comes from the outside and really struggles to adjust to the culture, and it was the biggest investment. Same thing, you also have to give them time, but a lot more success internally. And I think those are some of the key learnings. We're telling this story as if you guys, I told you guys the outcome, but you should keep in mind that this has been so hard, and many times we thought we were out of business. Our seed A and B, not seed, our Series A and Series B were like days and weeks of runway. Not everybody even knows this, but when we were closing our Series A, we had to get breakfast with one of our angel investors and beg for a $25K check to take payroll on the following Monday. Our Series B, things got delayed for a bunch of reasons, and we kind of had a plan B. If we don't raise by this day, we have to let go 70% of the team. So it's always been very, very difficult. And I've also, with very rare exceptions, I've never met a founder who ended up building a successful business but didn't go through many times where they thought it was over. So if any of you is having serious struggles, that's very much expected and part of it. Don't give up, because it's hard. It's hard for everyone.
Yeah, one of the sayings that I think about frequently is that it doesn't get easier, you just get faster. And I'm a cyclist, and we say that in cycling, but I think it's so true in that even as you are able to raise money and have commercial success, the challenges just get different. And it's not necessarily easier than those early days. And so I love that point that you brought there. We only have a couple of minutes left, but I wanted to give you the opportunity to tell us some lessons you've learned sort of in the enterprise sales space as a founder-led sales that you think would be most applicable to this group, especially as we think about looking in, more alternative ways of delivering care, like in the safety net and, Medicaid, Medicare type populations.
Yeah, very good question. So as like a founder-led sale, where you are doing most of the heavy lifting, spend a lot more time listening than talking. One, because you need that. You need to learn so you can figure out what to do with your business. Two, because there's like scientific evidence that when people are talking and talking about what they do, they get a lot more comfortable. They bring their guards down. So you're actually more likely to be successful getting them to the next stage. In my experience, the deal never happened in the official meetings where they invite everyone and all of that. You have to work the deal in between. A lot of one-on-one relationships. You need to understand what matters to every person and how this can help them and make them successful. Generally, folks in these orgs are very risk averse. There's a lot more to lose than to gain for them. They don't have any upside. They don't, they're not gonna get a raise for being the most innovative. Most of these folks are just salaried employees, so you can understand their position really well. I can't emphasize enough the point of honesty and transparency. Most people is like blasting them with emails about their tool and all the benefits and how it's the best thing on earth. I think it's actually a little better to talk openly about where you're strong and where you're weak, because you immediately gain their trust. And then they can work with you as opposed to, you're just selling into them. What else was critical for us? And try to build a relationship with them that goes, beyond. If they will like your business because it has an impact. And very important, tell your story in the most human way. For years, I wouldn't talk about my why, and I was like, that's kind of weird. Like, why would I talk about my personal experience and all of that? And then in 2020, beginning of 2020, I was invited to the Optum has this provider meeting with all their provider leaders get together once a year. The prior year, they didn't invite me, and I just flew down to Florida, snuck into the event, and met with a bunch of people. And the ventures team found it so funny that I'd done that. They invited me, put me on the main stage, and told their story to everyone. And I knew I was going to speak to like 1,000 people. So someone in the team, who's a former consultant, said like, hey, Bain, they would bring like, coaches and all of that, public speaking coaches. Maybe we should get you one for this presentation. Great idea. They brought one person, and I gave her my pitch. It was like, had all the slides, all the data points, and how awesome the solution was. And she said, we're going to talk about you for 6 minutes and about RubiconMD for 4 minutes. And that's when I started telling my story. She had me like act this story on stage. And like, it's like the most embarrassing thing I've done in my life. Like, I had to practice, I couldn't do it. Like, it was crazy. I have never seen more impact. After the presentation, a lot of people coming, because that's the one thing they remember, right? They listened through a day of pitches and business stuff, and like an interesting, inspiring story. So massive learning from that. I think you want people to remember your stuff, know that you do it for the right reasons, and like get excited about your mission, more so than your business. Especially in a lot of folks in the Medicaid space, there's like better paid jobs like working at a Medicaid clinic or system. So what I found is a lot of the folks there are very mission driven. They care about the community. So with them, they will resonate even more. So definitely don't be shy, even if it's tricky and uncomfortable. You don't need to hire a public speaking coach. You can do this with, your friend, your partner, whoever. But make yourself vulnerable in that way, and immediately you'll gain people's attention.
Whew, I love it. I um,
Thank you.
took a ton of notes on those summary there. I just threw them out because I think those like 4 points were fantastic way to finish it up here. So Carlos, thank you so much for coming on, spending an hour with us, sharing some of the wisdom that you learned along the way in your story. Super appreciate it. And yeah, thank you.
Thank you, guys. This was fun. Happy to help. So, if anybody wants to reach out, Niko can share my contact info. But good luck to you guys. Excited for everyone's success to keep growing.